Hi, good morning, everyone. I am trying to let some people in from the waiting room. I know people are going to be trickling in for a few minutes, but great to have you all on with us this morning for our virtual Advocacy for Thriving Communities training. I'm Emily Beauregard. I'm the director of Kentucky Voices for Health, and I'm a member of the Thrive Kentucky campaign. And I am joined today by representatives of each of the organizations that you see on the screen here, who are our Thrive Kentucky partners, and we'll all be providing different pieces of this training to you today. Now, this is the same training that we've been doing across the Commonwealth all summer and fall. If you were able to join us in person, this will be a refresher, and we always provide updates if something's happened between then and now. But we had gotten a lot of requests over those, in-person roadshow stops to have something virtual, have something recorded. And so we wanted to do that at the end of the year to kind of close out our Thrive Kentucky series for 2022. It's hard to believe that the end of the year is already here. And we will continue doing these in 2023, but we are not going to be doing them every single week for 15 or 16 weeks in a row. Starting in 2023 and after the legislative session, and we'll be doing about one of these a month in different communities around the state. And then we'll be doing our virtual state and federal policy updates every other month that we're not doing things in person, so that we can keep you up to date on everything that's going on at the state level, the federal level, and opportunities to advocate. So I am going to share a little bit of information with you about the Thrive Kentucky campaign. I think that most folks are now familiar. If you're interested in learning more about any of the organizations that are Thrive Kentucky partners that participate in this campaign, these are links to our websites. And these are the guiding principles that really help us determine what kinds of policies and systemic changes we want to advocate for. We want to make sure that they fit within these guiding principles so that we're advocating for a strong and an equitable safety net so that all Kentuckians can thrive. And those systemic changes really are sort of at the policy level, often state, sometimes federal, but you can think of these also at the institutional level and within your own organizations. But we want to make sure that we're creating a welcome mat with the public assistance programs that make up our safety net, and that we're making sure we're taking down barriers for folks so that we're leveling the playing field. And we do that by really focusing on policies that are both anti-poverty and anti-racist. And one thing that we always like to ask is what questions you're bringing to the webinar today. We know people have a lot of questions about housing assistance because housing is just a huge need in Kentucky, especially affordable and livable housing. And we also know people have questions about recent legislation and how it impacts their communities. Transportation is a big one we hear about, behavioral health. So as we're going along today, if you have a question on your mind, something you want us to touch on, please just put that in the chat. And we'll try to either touch on it while we're speaking or in the chat. We usually have a very active chat going on through these. And a little bit of housekeeping. We are, a lot of people on the call today, so please be sure to mute your line as we're speaking and use the chat if you have questions or comments. We would also like you to let us know if you need CEUs, especially if you're a certified community health worker or a licensed social worker, but we are offering CEUs for this particular training for quite a number of different professions. So if that is something that you're interested in, you can email Cody and I'll have his email address up soon. We can also put that in the chat. And then just about an hour before this presentation, I sent anybody who was registered the online or the electronic packet of information that you can reference as we're going along. And then we'll follow up with a longer email with even more resources and with the slides after today. And so I think I've covered that. Let's see. Here are our learning objectives, which we need to share for the CEUs, and then our agenda. We won't be taking a break today because it's virtual. This is the agenda that we use for our in-person shows, and that's also in your packet. But before we get started, I wanted to say a big thank you to our Thrive Kentucky sponsors. Having sponsors helps us to put these, roadshow and virtual sessions on for free to offer CEUs. We had some fantastic swag that we were able to provide at our roadshows in person. And if you're able to join us in person next year, you'll probably have an opportunity to get some of that as well. But we really appreciate the support, and it helps us continue doing this work. And if any organization is interested in sponsorship for 2023, we'll be putting out information about dates soon and sponsorship opportunities. So keep an eye out for that. Oh, someone just let me know that the chat isn't open. So I'm going to fix that. So if anybody has been trying to chat while I've been talking, just put your message in the chat again, and it should be working this time. All right, so with that, I'm going to turn it over to Dustin to give us an economic update.
All right, hey everybody. I see several familiar faces on here. A lot of folks I don't know. My name is Dustin Pugel. I'm the policy director at the Kentucky Center for Economic Policy. We're a nonpartisan nonprofit research and advocacy group out of Berea, but we work across the state and really focus on tax and budget, economic security, and criminal legal system reform work to benefit the lives of all Kentuckians, but especially lower income folks, which is really the group of folks that we're talking about today. And throughout this roadshow, we've really liked starting with laying the groundwork for the economic conditions that really create the types of need that the programs and the offerings that we're going to talk about today seek to fulfill. So we always like to sort of ground it here first, and then get into some of the programs. So let's go on to the next slide. And of course, the main way that people find economic security is through jobs, and through their work, through their income. And I'm guessing, unless you've been living under a rock for the last several years, folks will know that we've really been coming out of a really deep hole as far as jobs go in the state. But the good news is that we recovered over 300,000 jobs in less than half the time it took us to recover the jobs we lost during the Great Recession. So these lines here represent the 2007, the Great Recession, the 2001 sort of what people sometimes call the dot-com bust, and then the 2020 recession, which is the COVID downturn. And we really have had a remarkable return. We are now 1.2% above our pre-pandemic levels of employment, which is remarkable. And it doesn't show any signs of slowing down. So that's great news. It's really, I think, thanks in large part to 4 large rounds of federal aid, from the Families First Act all the way to the American Rescue Plan Act, through things like boosted child care subsidies, direct checks sent to people, boosted unemployment benefits, paid sick leave, and many, many others. So, it's been a really, really rapid and strong recovery as far as jobs go. So let's go on to the next slide. And the result of that strong recovery is that workers have a lot of options right now. The labor market has done what we call tightening, which means essentially there are more open positions right now than there are people looking for those jobs. This line graph here shows a measure of that tightness, which is just the number of openings over the number of unemployed workers. So right now there's about 2 openings for every unemployed worker, which means that workers have been able to push for higher wages. They've been able to push for better working conditions. They've been able to quit jobs that they don't like or that haven't fit their career goals to find other positions that are better. And that's really great. It's led to a lot of unionization efforts and things like that. But of course, this could change really quickly. Openings really are just, they can turn on a dime, and that has happened in the past, and it could happen in the future. And of course, that tightness is real on average, but it's not true for everyone everywhere. So let's go on to the next slide. And I'll get to that in just a minute, but just another way of showing tightness is the number of people claiming unemployment insurance. So you'll see here there was a really unbelievable swell in claims of folks who were laid off early in March and April of 2020. And it's been falling ever since then. It's fallen even while the $600 benefit was in place, while the extra $400 were in place, while the extra $300 were in place that we had during the worst of the pandemic. And now we are well below pre-pandemic levels, and we have been since the middle of 2021. There's one spike there you'll see that's really just that smaller spike. That's back paying claims that were not paid out earlier. But we're in a really good situation right now. So let's move on to the next slide. Like I said, that's true on average, but the truth is if you live in rural Kentucky, you still haven't recovered from even the Great Recession. So counties that are considered rural have about 10% fewer jobs than they did in 2007. Counties that are considered urban have about 10% more jobs now than they did in 2007. And you can see that on this map here, it's sort of faded, but that really holds true for Western and Eastern Kentucky, whereas sort of the Bowling Green, Owensboro, Louisville, Lexington, and Northern Kentucky areas have done very well. Men recovered in 2021. They recovered all the jobs that they lost during the downturn, but women were still lagging behind. That's largely because they had caretaking responsibilities, including both their own kids and also older loved ones. And of course, there's a long history of racial disparities in our labor market, and that is still true. Black Kentuckians were being laid off at a higher rate than white Kentuckians as of the last quarter of last year. And that is, something that remains true and needs to be changed. And that's a product largely of the types of industries that Black people work in, again, because of essentially intergenerational issues that persist. So let's move on to the next slide. One thing we want to make folks aware of is House Bill 4, which is a bill passed this last session that cuts unemployment insurance by limiting the amount of time that people can make claims. It cuts maximum duration from anywhere between 12 down to anywhere between 12 and 24 weeks. For 84 years, as of right now, it's been 26 weeks, but starting January 1st, it's going to go back down to 12. This chart here shows essentially the number of weeks that would have been cut had House Bill 4 been in place over the last 30 years. And as you can see, there's only 2 6-month periods in which it would have been anywhere close to 26 weeks. And throughout all of 2020, it would have been 12 weeks, even when the unemployment rate was as high as 16%. And that's a byproduct of the way that they choose the unemployment rate to create the number of weeks that are available. It also increases the number of job search activities each week from 1 to 5 per week, which is a problem because it also has this really wonky requirement called a suitability standard. Essentially what that means is there's a standard for what type of job you must accept when offered to you while you're on unemployment benefits. Up till now, it's been pretty flexible, gives people a chance to look for a job that meets their skills and in their career field that's close to home. What this does is it changes it and it says essentially after 6 weeks, you have to accept the first job offered to you and therefore have your unemployment benefits cut off, so long as it's within 30 miles of your house, regardless of whether or not it meets your skills or abilities or in your career field, and as long as it pays a little over half of what your last job paid. So it is really a recipe for lower wages and is designed to cut people off their benefits earlier. It also includes something called work sharing. That's a good thing. It provides a supplemental unemployment benefit to people who have their hours cut at work through a managed reduction in hours from an employer. It lets people stay on their job while also receiving benefits, just a lower number of hours. That's great. I think it's something we should have done a long time ago. It's not worth the cuts that we've seen in House Bill 4. All right, let's go to the next slide. And at the same time, we know that consumer prices have been rising very rapidly in Kentucky and across the world. In fact, that is, like I said, a global issue related to the way we changed our spending habits in 2020, and then the sorting out of that since that time. And also the war in Ukraine, which has hugely disrupted things like fertilizer, corn, wheat, natural gas, oil, and has created a price spike for just about everybody. These lines over here show the price increases year over year in the Southeast states, which include Kentucky, for food, which is obviously that green line at the top. That's been the one of the quickest increases in prices. For all items, which is what it sounds like, and then core here at the bottom, which takes out food and fuel and just looks at everything else. And even that has been elevated, although folks may have seen the news earlier today. It looks like that is starting to decline, which is great. But what this has meant is higher prices for everyone. So let's move on to the next slide. And prices were already more than most folks in Kentucky could afford. So this is a graph that shows these blue bars, what it takes for families of different sizes and different numbers of adults who are working to get by comfortably, but not, not getting rich either. This is just basically what we would consider a secure but modest livelihood. And this includes one adult, two adults with one working, and two adults, two working. And it also shows these yellow lines here. The bottom one is the median wage in Kentucky, and the top one is the median household income. So you'll see that the only groups of people who can get by okay in terms of the median, which means up to half of workers in Kentucky, are folks who don't have kids. If you have kids, then you have to buy more food. You have to afford childcare. You need more housing space, and all of those things are increasingly expensive. And that makes it difficult for people to get by, which is again why we're going to be going over the programs that we're going to talk about today. Okay, next slide. In order to address primarily one aspect of that, which is healthcare costs, Congress passed the Inflation Reduction Act earlier this year. We're going to start seeing the benefits of, well, we already have started seeing the benefits of part of this with the extension of the American Rescue Plan Act subsidies for the marketplace, which is currently ongoing. We'll talk a little bit more about that later. But it should also start reducing prescription drug prices beginning in 2020, I think it's 2024. And again, we'll talk a little bit more about that later. It also will ultimately reduce energy costs as it provides a lot of investment for the electrification and renewable energy creation of America. And that's something that will continue for years to come because of these investments. And it does this by primarily taxing wealthier individuals and corporations, as well as providing adequate funding to the IRS. All right, next slide. Just before we jump into all of the safety net programs that we're going to talk about today, I think it's helpful to point out that we have a really great resource through the Cabinet for Health and Family Services that shows the sort of individual impact, but also the collective impact of these programs on each county in Kentucky. So I encourage folks to go check that out. They're really interesting. I think it's important to remember that these programs, like every program, not only help the folks who are using it, but they help the entire community as people spend those benefits. They get to stay in their homes. They're contributing to their local communities. So I think it's useful to see this not only as a marker of how well we're doing for folks who really need some help, who need support, for working families who are looking for a hand up, so to speak, but also to see how this benefits everybody who lives near them. So with that, I will hand it over to Emily, or I'm sorry, Marcy, excuse me.
Thanks. I'm Marcy Timmerman. I am the Executive Director of Mental Health America of Kentucky. Mental Health America is the oldest mental health advocacy organization in the country. So in case you're not familiar with us. Next slide, please. Thank you. Let's all engage in a quick mental health technique to take care of ourselves, to clear our minds, and to get ready for taking in helpful information from the entire presentation. Not that Dustin's wasn't helpful, it is. If you breathe in while the donut is getting bigger and out while it's getting smaller, it's a breathing exercise. It's a great tool for reducing anxiety and coping with stress, and we all have stress. Hate donuts? You can find handy gifts for triangle breathing, square breathing, and circle breathing, all great techniques. The plethora of options for gifts and tutorials on breathing exercises is actually a good setup for the rest of our conversation on behavioral health. There's something for everyone, but no one thing works for everyone. Meeting people where they are and helping them to recognize what is going on with themselves and define what works for them is at the heart of all behavioral health work. Next slide, please. So this is the tree of adverse childhood experiences, ACEs, and underlying root causes. ACEs, abuse, neglect, and household dysfunction, increases a child's chance of mental illness and/or chronic conditions as an adult. Toxic stress from ACEs affects the structure and function of children's brains. Historical and generational trauma can alter DNA and be passed down from parent to child, sometimes through multiple generations. Unfortunately, ACEs are common. Most of us have at least one. Many of us have 4 or more, but we're learning more every day about how to help develop protective factors against ACEs and how to overcome their negative effects. As you see in this diagram, ACEs are rooted in systemic causes which must be addressed: poverty, lack of opportunity, violence, community disruption, and discrimination. Nearly every topic you'll hear about today can help address these root causes. Next slide, please. What are the positive experiences that contribute to lowering the risk of all these negative things? We're calling these positive childhood experiences, or PCEs. PCEs are experiences that benefit every single child and contribute to the resilience of children who face adversity. This is an emerging area of research and practice aimed at helping children, youth, and adults develop protective factors like resiliency, positive relationships, support, and self-esteem to combat the negative effects of ACEs. I want you to think about your own childhood as we read through this slide. Keep the answer to yourself, but how many of these experiences did you have? How many have you helped create for children and youth in your area? And how can you support efforts to make sure every child and youth has these? So the positive childhood experiences are the ability to talk with family about feelings, felt experience that family is supportive in difficult times, enjoyment and participation in community traditions, so maybe some of those festivals and things, feeling of belonging in high school, feeling of being supported by friends, having at least 2 non-parent adults who genuinely care, and feeling safe and protected by an adult at home. One more way to make a difference is to support policies that make it more likely for these positive childhood experiences to happen. We can work collectively to build these experiences for Kentucky youth. Next slide, please. So how do we prevent ACEs? How do we stop them from happening? Well, there's a lot of them, right? This is a big slide. Some of my favorites are family-friendly workplaces, safe dating and healthy relationship skills programs, and victim-centered services. Which ones call to you? If you'd like to connect with groups working to bring these solutions to the Commonwealth, just reach out to MHA Kentucky or the Thrive Kentucky organization most closely related to this issue. Next slide, please. You'll see the list of prevention tactics really builds off the social determinants of health model that's been recognized in physical health for some time. Did you know we have a set of social determinants of health now too? Of mental health now too, sorry. Researchers created this graphic to help better illustrate the connections we have with the systems around us. 1 in 5 of us will have a diagnosable mental health condition in our lifetime, and that's a pre-pandemic statistic. It's likely higher now. Not everyone will need extended treatment, but symptoms and their severity will indicate when they should see a professional. We all have stress in our lives, and some of us have learned to deal with it more effectively than others. But if these systemic stressors are layered on top so that they compound everyday stress and anxiety, the individual may experience conditions that develop mental illness and disorder and/or lead to addictions. Food insecurity, housing instability, ACEs, underemployment, poor access to healthcare, all of these connect to the larger picture of individual and community mental health issues in our communities and across Kentucky. Next slide, please. Kentucky's mental health safety net is composed of our 4 state psychiatric hospitals and our 14 community mental health centers, or I call them CMHCs. You can see them on this map. Supporting them in their work is a must for helping to alleviate the burdens created by social determinants of mental health. They are the safety net providers for individuals who are dealing with mental health issues, addictions, developmental and intellectual disabilities. These providers will see anyone regardless of their ability to pay. They take Medicaid, Medicare, and almost every other insurance payer or those without any coverage. The CMHC regions were established in 1964 to assure that every one of Kentucky's 120 counties would have access to these behavioral health services. There's a CMHC office in almost every county, and telehealth services have been more available than ever, opening up access to more individuals who were unable to keep appointments because of lack of transportation and childcare. The CMHCs are also responsible for providing emergency and crisis support services to individuals and communities, as we have seen with the recent tornadoes in Western Kentucky and the flooding in Eastern Kentucky. Next slide, please. For those who aren't already aware, 988 is the new 911 for mental health and substance use disorder concerns and suicide prevention. If someone is not having a medical emergency and no weapons are present on site, please call 988. In Kentucky, your call to 988 will most likely be answered by the Community Mental Health Center's crisis line operators. If you have the old National Suicide Prevention Lifeline number of 800-273-8255 in your phone or on your website, please replace it with 988, although you'll still be connected to the 988 system if you use the old number. It's important to note the first responders in the case of 988 are the call center operators. They're not police, they're not advocates of involuntary treatment, and your call remains anonymous. But they are trained counselors who can provide guidance and support and can put the caller in touch with immediate help if that's what's needed. One big difference between 911 and 988, you can call 988 if you're not sure what your options are to get help or to help someone else, even if it's not an emergency. Although the 988 system was just rolled out nationally on July 16th, 2022, the vast majority of the calls in Kentucky have been answered locally, which has been the goal. We want to connect individuals in need with local, readily accessible help and services. Next slide, please. So here's some suicide and self-harm statistics for Kentucky. Between 2016 and 2021, we lost 4,480 Kentuckians to suicide. The highest numbers are in the ages of groups of 35 to 54, with the most common means by firearm. There's been an alarming increase in suicides among adolescents and college-aged Black males in Kentucky. There have been increases of 100% in suicides for the 55 plus population, particularly among white men over 60. We are also seeing increased suicide among our farmers, worsened by increasing debt, extreme weather, uncertain prices, and isolation. A good resource is raisinghopeky.com if you are working with families of farmers or farmers themselves. If you want to know more about suicide prevention in general, safe firearm storage, getting trigger locks, or racial trauma, please contact me, and my information will be in the chat shortly. So next slide, please. So we've established with those first two slides, right, of this, that suicide is a growing issue of concern here in Kentucky. One thing we can do about that is to set up a mechanism to permanently fund the 988 line here in Kentucky. We're working on that, but unfortunately right now, we don't have a bill this session. We did that is because we have 33 new legislators coming into the session. So we've got a lot of people to educate about mental health and what it actually means in the first place and how important suicide is. So we're not putting the bill in, but if you'd like to be contacted with ways to reach out to legislators in your area, get the talking points, the data, the updated information, please go to fund988ky.org and sign up for that. Next slide, please. And one last thing, I wouldn't be MHA Kentucky if I didn't plug our screenings a little bit. Before you need 988 or suicide prevention line, mental health screenings are very helpful. They're free online. You can test them by taking the quiz and answering test in the zip code box. So that's if you don't want to take it for real, right? Just put test in the zip code. We'll throw out your data. These are clinical screenings used by doctors and therapists in their offices, but we made them available in a friendly online format. You can choose the area of greatest concern or worry for yourself or a loved one and get a self-assessment of how serious the symptoms may be. You and your family member can then be connected to resources with more information, tips for self-help, and access to resources such as 988 and our community mental health centers. Next slide, please. Here's a summary page of some important resources to keep handy. More information and support are always available for anyone who wants to reach out for it. I encourage you to do that. Y'all remember when we mentioned ACEs in the beginning of this presentation, though? One of the factors is housing instability. Here to tell you about housing and housing opportunities is Adrienne Bush.
Thanks for the segue, Marcy. That was great. I am Adrienne Bush, and I'm with the Homeless and Housing Coalition of Kentucky. And just want to be clear that at HHCK, we value housing as a human right. We also believe that housing is what solves homelessness. And we're a statewide housing advocacy organization with an informed perspective as we provide supportive housing across the Commonwealth. Next slide. Okay, so we're often asked the question, why is housing so difficult? And there are lots of complicating factors, but it starts with a fundamental question of whether housing is a human right. As I said before, we think it is, but policy hasn't quite caught up, as we'll see. This list is not exhaustive, but it's intended to provide a context for understanding how housing assistance is distributed and the results that ensue. Next slide. Okay, so when I'm asked how many people are experiencing homelessness in Kentucky, one of the resources that we look to is the point in time count, or K count. And it does have its limitations because of the transitory nature of people without a fixed address, and that's generally how we count people. Look at the census. But it can be helpful when viewed over time, year after year, as well as by jurisdiction. And these two graphics show that, generally speaking, homelessness was declining since about 2013. We have some preliminary numbers from 2021, which was a sheltered count only. The point in time count counts people who are experiencing literal homelessness, which includes people in shelters, people in cars, people living on riverbanks and parking garages, etc. And so the graphic on the right shows that it's not just a Louisville or Lexington issue, that over half the people counted in the 22 PIT count were in what we call the balance of state, which is the other 118 counties outside of Jefferson and Fayette. Kentucky is the only state that does the county by county analysis, which provides richer data, but it also takes more time. Next slide. So homeless assistance is extremely regional and localized. So one of the things that we do is try to maintain a contact sheet of homeless service providers by county and by area development district or region. So for example, on that spreadsheet, which is linked, which you will get in the slide deck, we've got a couple of providers in the Gateway Ad District. Next slide. To continue the conversation about ACEs, we know that homelessness is definitely an adverse childhood experience. We know that the connection between ACEs and housing insecurity writ large has been explored by the National Healthcare for the Homeless Council and the Bassuk Center. This fact sheet that was published in 2019, that's where a lot of these bullet points come from. And we know that basically, the number one takeaway for you is that children living in poverty, including those experiencing homelessness, are more likely to carry high ACE scores, which then increases their risk of developmental challenges and poor health and functioning. Next slide. Okay, going to the opposite end of the age spectrum, we know that nationally, our homeless population is aging. With homelessness among older adults, we see an emerging crisis with the baby boomer generation representing the largest age demographic and growth of homelessness. And so, and people specifically 65 and over. So along with that, we wanted to remind folks of considerations for providers in the time of COVID-19, just because we know that age is a risk factor for serious COVID illness. And that is, we want folks to carefully consider risk to older adults before dismantling COVID-19 safety measures. I was at the emergency shelter of Northern Kentucky yesterday, and they are still requiring masks because they're in a congregate setting. And they're also dealing with not just COVID, but it's flu season and cold season, and now we have kind of a resurgence of RSV. So these are some helpful tips from the National Alliance to End Homelessness. All right, next slide. Statewide rental need. There is such a connection between inadequate, unaffordable rental homes for folks and people experiencing homelessness, especially with our extremely low-income Kentuckians, folks who are at 0 to 30% of the area median income. So statewide, we know from the National Low Income Housing Coalition that there are only 54 homes available and affordable to our lowest income neighbors. That also translates into a shortage of about 79,000 rental homes that you can see in that graphic on the left. The other way to kind of look at rental need is the affordability piece of it, not just the availability. And so in Lexington, the hourly wage required to afford a 2-bedroom home is $17.50, while the average renter wage is under $15. And we know that, of course, minimum wage is stuck at $7.25. Renters without a housing voucher start at a significant deficit that leaves them very vulnerable to unplanned income disruptions. Next slide. Okay, but one of the things that has really helped out over the past couple of years has been the availability of emergency rental assistance that was initially passed by Congress in December 2020, and additional money was made available through the American Rescue Plan Act. So right now, we recommend that folks who are behind on rent, who have experienced an income disruption, look to the Healthy at Home Eviction Relief Fund for rental assistance. Those for that includes all of the state except for Lexington. Lexington is still running their own program. Next slide. So in 2021, we took a look at the Healthy at Home Eviction Relief Fund because this was a brand new program, and it's something that advocates have been saying we needed for years, but especially during COVID-19. And you can see that when programs are stood up from scratch, like it takes a minute to get started. So the program opened up in March of 21, and month over month really hit the high point of spending in October of 2021. Spending kind of leveled off. And then in 2022, the Jefferson County applications were folded into the state fund. So the spending has gone up again in 22 around it with emergency rental assistance. Next slide. Another really good program that was part of the American Rescue Plan Act was the Homeownership Assistance Fund. Different states, all states were granted a certain amount of money to help homeowners, people with mortgages, and who were behind due to a COVID hardship with their mortgage and utility costs. So the program is still open. It is at Protect My Kentucky Home or protectmykyhome.org. Kentucky was the first state to open their fund, and it is still open. Okay, next slide. And lastly, part of the reason we participate in the Thrive Coalition is because we know that opportunity starts at home, and we know that we have significant policy connections and stability connections between different policy areas in housing, like education and health and racial equity, criminal justice, hunger, you name it. And so in Kentucky, we do have an Opportunity Starts at Home campaign. It's convened by the National Low Income Housing Coalition, and in Kentucky, the state partner lead is Kentucky Equal Justice Center. So if you are a food justice advocate, you may find that work very interesting, and I would ask you to consider contacting Kentucky Equal Justice Center to learn more. And with that, I will turn it over to Jessica Klein to talk more about hunger and food assistance. Thanks.
Thanks, Adrienne. There are a couple questions in the chat for you when you have a chance.
Okay. Hi, I'm Jessica Klein. I'm a policy associate with Kentucky Center for Economic Policy, and I'll be talking about hunger and food assistance programs in Kentucky. So right now in Kentucky, hundreds of thousands of our neighbors are just one job loss, missed paycheck, or medical emergency away from hunger. And that includes 1 in 7 Kentuckians and 1 in 6 Kentucky children. The unmet food need is estimated at almost $303 million. And of course, Black, Latino, and Native American communities in Kentucky have always been higher because of systematic racial injustice, and the pandemic has exacerbated hunger for thousands of Kentuckians, and these systematic barriers remain. Kentucky also has the nation's highest rate of food insecurity among seniors and older adults between 50 and 59 years old. On top of all of this, a lot of the program extensions we've seen throughout the pandemic have ended or are near end in the coming months. So some of Kentucky food banks are even reporting some of the highest levels of need since the pandemic. So I'm going to talk about several of the food assistance programs in Kentucky. These are kind of the top 5 right now that I'll be covering. And so Supplemental Nutrition Assistance Program, or SNAP, previously called food stamps, is the premier food assistance program for low-income Kentuckians. We also have WIC, Women, Infants, and Children, which provides grocery money to pregnant breastfeeding moms and children under 5. We have the National School Lunch Program, which is free and reduced lunch in schools. The Pandemic EBT Program, PEBT, if you will, which provides grocery money to families who lost free meals in school during the pandemic when schools were closed. And then that program was expanded to provide grocery money in the summer, and that was called the Summer EBT Program. So that was that included both school-age children, and then families on SNAP with kids under 6 could participate in those programs. And I just want to mention that participation in these programs does not impact citizenship in any way. And the 5 highlighted programs do not require proof of citizenship, and they never have. Next slide, please. So here you can see a little bit about the monthly SNAP participation in Kentucky from Kentucky Policy's SNAP tracker. And I just want to point out a few key dates here. So SNAP enrollment began to decline in 2013 as the economy improved and people no longer needed assistance. But since then, that point marked here, you can kind of see that there are 2 instances since then that enrollment accelerated, and that's February 2016, when there were large disruptions in enrollment, followed the defaulty launch of a new online benefits program, Benefind, and then in May of 2018, when enrollment dropped again with the reinstatement of a 3-month time limit for some adults in Kentucky. And then kind of the last little increase there is the 16% increase that we saw in April 2020 as a result of the pandemic. And really all of this is just to say that SNAP responds really effectively to changes in the economy, and the economy recovers jobs and moves towards these pre-pandemic levels. So we'll see SNAP participation continue to fall. And again, we'll likely see a decrease whenever the time limit is reinstated at the end of the federal public health emergency. Next slide. And I just want to talk a little bit about SNAP participation across Kentucky. So it varies broadly, but every county in Kentucky benefits from SNAP. Both individuals that receive that assistance and then local economies, because SNAP is spent really quickly in communities. People, use that money monthly to buy groceries at local retailers, and then it helps to stimulate local economies that way. So it does range from about 2% in Oldham County to 38.9% in Owsley. But again, thousands of Kentuckians received this benefit, about 12.1% in March 2022. I think we have some updated numbers coming soon on this, so I'll be happy to share that. And then, yeah, you can see here too that benefits spent in March were much lower than those spent in May. It was in March about 132.9 million versus 83.6 million in May. And that is because of the passage of Senate Joint Resolution 150, which ended the public health emergency in Kentucky and therefore changed the amount of benefits that people were able to see, and because of the end of emergency allotments. And I'll kind of go into that in the next slide. Yeah, so here I want to talk about the end of these emergency allotments. They were also called max allotments to some people. But basically what that did throughout the pandemic was allowed Kentuckians to receive the maximum amount of SNAP benefits for their household size. So instead of being, based on just income and those regular measures, it included the maximum amount that you could receive for your household size. So we received that throughout the pandemic, but it is connected to our public health emergency. So when Senate Joint Resolution 150, sponsored by Senator Douglas, passed last March, it ended that declaration in May, which greatly reduced the amount of benefits that SNAP recipients could see. And that included about 42% of all of the SNAP benefits in the state of Kentucky. And so that's almost 50 million per month that we are no longer seeing come from the federal government to individuals to buy food. And again, helping to stimulate those local farmers and grocery stores. So this is still counting as the federal public health emergency continues. We'll still be missing out on this money. Next slide. Yeah, and with those emergency allotments ending, and that impact has a huge impact on seniors in particular. And we know we already have, the highest rate of seniors with facing food insecurity in the nation. It's really important that people think about all the possible deductions that they might be eligible for with SNAP so that they can get the maximum amount of food assistance that they're eligible for. So these are just some of those deductions. And yeah, it's important that people look into those. Next slide. Okay, a little bit about SNAP fraud. I just, wanted to point out, this is usually the point in the presentation where I ask, who all has heard about fraud and how much fraud do you think there is in Kentucky? I'm not going to ask that today, but I just kind of want to point out there's differences between fraud and application fraud and those different kinds of things, trafficking of benefits, which is like selling your benefits to buy certain things, those kinds of things. But really it's much closer to 1%, as you can see here, of in trafficking. Next slide. And then this one is the fraud piece. So the last one was trafficking, the selling of benefits versus intentional fraud here, which is less than 0.15%. Next slide. Okay, and then moving on, I just want to talk a little bit about WIC, which is the Women, Infants, and Children program. We actually saw a pretty good increase in WIC throughout the pandemic. There's been some additional funding to help with WIC modernization, more flexibility within that program in terms of being able to apply online, see your benefits online, those kinds of things. And those improvements have helped because participation increased. But the largest group of people that receive WIC is actually kids under 1, infants. And that's really important right now because there is an infant formula shortage. The damage of this shortage has lessened. So it's really those dairy-free and hypoallergenic formulas that are still really hard to find. for babies that need it. So we just want to point out that the WIC office in your county has updated information on infant formula and the different options out there, and then what is covered by WIC. So you can reach out to your local health department for information on WIC. Next slide. So I'll just finish off with talk a little bit about advocacy in Kentucky. The Kentucky Food Action Network is a statewide network that works on all things food, farm, and hunger policy in Kentucky. And we have a wide range of people, individuals, communities, and organizations that participate in this network. So if that's something you're interested in, you can click on the link in the slides when they're provided to you to join that work. But a couple of opportunities coming up. We're definitely doing a lot of work on the federal level this year. The Farm Bill is about to pass and is being discussed this year, so it'll likely pass in the next year. And we're looking at the different components of SNAP that are in there. We want to remove all barriers to SNAP enrollment and participation. And there's a few things we could see being included in that Farm Bill. We're also taking a look at the Child Nutrition Reauthorization Package, and which has a huge impact on school meals and those other programs that I mentioned that impact kids. And then statewide, we're doing a lot of administrative advocacy, talking about benefits cliffs, fighting some of the false narratives, like I talked about fraud a little bit, around the safety net, and then also engaging with the Department of Agriculture around supporting farmers and feeding programs. And I think with that, I know that there was a lot going on in the chat, so I'll check that out. But I think other than that, I'll turn it over to Kara Stewart.
Hi, all. So look, Stephanie was in the chat as I was like throwing Stephanie out to somebody. So childcare, you probably heard this already today, that part of the reason Dustin mentioned that women haven't been all the way back in the workforce has been childcare. Some of the reason that lots of people have had a hard time recovering has been childcare. Well, it's not a secret why that is. Childcare is unavailable. So over the past decade, you see that like down slope. We had an injection of state funds that stopped that hard slide, and then why it kind of mostly leveled out with some federal funds. But the federal funds only last, for until the end of, I guess, year after next year. The years at the end of the year, it's hard to do the math on which year is next year and which year is the year after. But basically, we have half of what we used to have, and when we had that, it still wasn't enough. So half of Kentucky is a child care desert. That is a crisis. And I hope everyone's putting together the dots right there, that if you don't have a place for children to have high quality childcare, it is unlikely that parents are able to work. So this infects, especially younger families a lot directly. Next slide, please. And then this one's the real banger here that nobody was expecting to see coming here. Joking. Everybody knows this. Childcare is unaffordable. If anybody knows of affordable childcare, please share it with everyone in the chat, because overwhelmingly across the state, childcare is unaffordable no matter where you live. If you'll look at those stats in there, it is almost 20% of the state median income. It's almost what you should be paying on your housing for one child, which is not sustainable for anyone. That's something we have to have public investment to fix. We cannot rely on the disproportionate impact to younger families and families with children to be able to keep the workers we need in our workforce. We have to have public investment in childcare. So if you take anything away from me today, that's it. We need public investment in our childcare. Next slide. Now, there is this sort of like silver lining good piece of news. There's actually two. So one good piece of news is that there's the child care assistance, CCAP, for families is actually at the highest level it's ever been. So even if you've had clients or you yourself have not been eligible in the past, you may be eligible now. Now, again, you're going to run into that same problem of finding a place to use it, but you may be eligible for money you weren't eligible for before to pay for it. The other piece of good news, which is really like kind of a breaking news situation, which we seem to have more often than we think we're going to with these, is that childcare employees. So if you work as a childcare provider in a certified childcare program, you are eligible to have all of your household income excluded from CCAP application, because we do have some folks who work as childcare providers and aren't able to. Now, a lot of obviously individual providers just allow them to bring their kids for free. right? Because they're like, we want you to come to work, bring your kids. But if you aren't at a place like that, you now are eligible for CCAP because all of your income is going to be excluded from that. So that's two pieces of good news. One of them is kind of a breaking news that just happened as of October 24th of this year. So I don't know how far the how far that word has spread. And the next slide. And we've heard about ARPA from a lot of folks today. I think almost everyone has mentioned ARPA because ARPA put a lot of money into meaningful programs that support working families in Kentucky, and childcare was no exception. So money from ARPA made it possible for us to create a lot of grants. Pretty much all of those, the deadline is December 31st. So anything that is still available, the individual $5,000 and the up to $100,000 for employers, those you need to apply, get out there and apply. So, and I'll put it into the chat, but it is Jessica Kane at ky.gov. I will copy that right now. She's who you have to email to receive any of those childcare grants or spread the word about that by December 31st. So there will hopefully be some funds left to reopen that, but that's the deal right now. And the other good news is that a lot of our public schools have added some not preschool, but aftercare hours before and after school, which is also paid for through ARPA. So you can also check your school to see if there's more time available at the school that can be paid for by CCAP. All right, next slide. Here it is, the public preschool partnerships. So if you qualify for CCAP or if you have an IEP, you can get a bonus 3 hours of childcare at a public school if that school is participating, but a lot of Kentucky schools are. Next slide. So all of us are asking for all of you, and I take the responsibility too. I make my phone calls too. We all have to ask. We all have to contact our legislators. Adrian was in the chat talking about protecting source of income, protecting source of rent for housing. That's extremely important. The same thing is true for childcare. It's all important and it's worth asking about. We know how to fix childcare. We have to put public money into it. And guess what? We know how to make that happen. This is maybe a little bit dated. We go to the next slide. So I was going to say there's 2 people who could for sure make it happen, but given the current setup of the Senate, maybe they aren't the only 2. However, I still am confident that if we convince these 2 folks who represent us that we need a significant public investment in childcare, it will happen. Obviously Mitch McConnell is no longer in charge of the Senate, but that doesn't mean that he doesn't still have quite a bit of power to make sure that things can move. And we know that most of the Democratic caucus supports a public investment in childcare, and it has passed the House several times. So they could make that choice right now very quickly before the House flips. So get on those phones right now and say, go ahead and do it. Go ahead and pass everything the House has already passed in terms of the earned income tax credit, in terms of the child tax credit, and in terms of our child care investments. They could go ahead and do that this week. And there's no reason that they shouldn't. And I think that's all for me. So we go back to Adrian.
Okay, great. I am back with the Homeless and Housing Coalition of Kentucky. So we're going to talk about Medicaid covered transportation. We know that thanks to Medicaid, many Kentuckians who wouldn't otherwise be able to receive quality healthcare services are able to afford it. However, that doesn't necessarily mean they can get there. Transportation to get to doctor's appointments has been one of the most frequently brought up issues when we talk to community members about staying healthy. But a lot of folks don't know that Medicaid actually does cover both emergency medical transportation, like an ambulance, as well as non-emergency medical transportation, or NEMT, for scheduled provider visits. So we're going to talk a little bit more about it. Next slide. The Department for Medicaid Services at the Cabinet has a contract with the Transportation Cabinet to oversee all Medicaid transportation. Within the Transportation Cabinet, there's a program called the Human Service Transportation Delivery. I always mix up those words. NEMT services are provided by one of 16 different regional transportation brokers as a part of that program. And the regional broker is who most Medicaid members deal with most directly. Next slide. To be eligible for NEMT, a Medicaid member must meet the 3 conditions. 1, that they have a valid Kentucky Medicaid card. 2, transportation may only be provided to and from a Medicaid-related service. Sorry, my phone is ringing. Okay, and then the individual must have an unmet transportation need. So to make sure all these conditions are met, the broker is going to verify the Medicaid number, review the trip purpose, and verify if public records indicate if a vehicle is registered to the applicant's household. And if any of these conditions are not met, then NEMT rides will be denied. Common reason being that the individual or someone in the household owns a vehicle according to public records. Next slide. So if that is the case, there is an exception. If a person can't drive or ride in a household, an exception can be made by getting a statement signed by a third party. This exception must be resubmitted at different intervals depending on the reason. You'll note for the issue of the registered vehicle not being capable of serving its point A to point B purpose, you're only allowed 3 mechanic notes a year. And the other option for this situation is to go to the county clerk's office and just junk the title. Here are some, next slide, yeah, sorry, Emily. We do have some examples of NEMT covered trips. Always try to go to the closest medical facility that will treat the condition, because rides can only be provided within the county or within bordering counties. And for care outside of that service area, like one of our major cities, the member is going to have to get their provider to complete a transportation referral in order to schedule a trip. Next slide. Okay, so there is a beautiful map here with a live link that shows who all the brokers are in the various regions. And so you can check that out when you get the slide deck. And here is the 72-hour rule. So the member or someone helping them has to call to schedule the NEMT ride at least 3 days before the appointment. If an appointment is on Wednesday and the office is closed on Sunday, the ride would need to be scheduled before Saturday at 1. Because it's supposed to be non-emergency, it's assumed that this shouldn't be an issue. But we all know that we're not always quite thinking about our appointments that far in advance. There are exceptions for the 72-hour rule for inpatient hospital discharges and for urgent care. Brokers have paging services available after normal scheduling hours for urgent care. And that is 24 hours per day, 7 days per week, including any holiday. But the urgent care provider has to verify with the broker that the care is actually needed urgently. Next slide. As I mentioned before, there are some issues with NEMT. It's important to separate these issues out into those that should not be happening and have, if not solutions, then they have grievance processes. Those are the things on the left. And then we have issues with current policies and regulations that need to be addressed at a more systemic level. We would love your help in addressing these with policymakers at the state level. So if you've had issues with NEMT, contact us, let us know, because there is likely that a bill around NEMT will be filed in the 2023 General Assembly. Next slide. All right, and here's the last page on this section. There are more links for more information on NEMT. Oh, just kidding. That was not the last slide. I always forget about this one. For students, for families served by Family Resource and Youth Service Centers, they also have some transportation capabilities to get children to their doctor's appointments, immunizations, and potentially school events. And to speak more on healthcare, we do have Priscilla Easterling next up from Kentucky Voices for Hope.
Thanks, Adrian. Hi, everyone. I'm Priscilla Easterling. I'm your neighbor from Kentucky Voices for Health. We believe that Kentuckians should have the opportunity to live a healthy life and contribute to the health of their communities. So Thanks, Kara. I was feeling very festive, so wanted to do something fun for our last webinar this year. So one of the things that's been front and center over the last 2 years during the pandemic is just how absolutely essential it is to have access to affordable healthcare and affordable healthcare coverage. During a pandemic is not a time when you want to be uninsured and not be able to access the healthcare or health coverage that you need. So today we're going to talk about how Medicaid really helped Kentuckians and what options are still available. Next slide, please. So during the beginning of the pandemic, the first couple of months of the pandemic, hundreds of thousands of Kentuckians said their jobs and what they thought was secure, and they thought they were covered, but suddenly losing those jobs meant that they lost their healthcare coverage as well. In fact, the rate of the uninsured rate for Kentuckians almost more than doubled in the first several months of the pandemic. But thankfully, Medicaid and marketplace coverage came in and really allowed Kentuckians to continue to access the healthcare that they needed. We're going to first talk about Medicaid. Next slide, please. So Medicaid is a literally life-saving, essential program in Kentucky. 1.66 million Kentuckians are currently covered through Medicaid. And in fact, almost all of us will be covered by Medicaid at some point in our lives. And Medicaid has been an essential program that really helped protect Kentuckians and keep them and allow them to stay connected to their doctors, their prescriptions, and all of the needed healthcare that they had. And Medicaid really stepped in and helped protect Kentuckians and Kentucky families. That's so important. Just want to make sure that we understand that. Medicaid is part of a strong safety net that protects Kentucky families. Next slide, please. One of the other important options that Kentuckians had was access to marketplace coverage. Now, the marketplace coverage is also on Connect. Thankfully, we have our one-stop shop back. And marketplace coverage back in March of 2021, the American Rescue Plan Act passed, and it removed the upper limits to eligibility for tax credits, also known as premium subsidies. And it also increased the subsidies that were available along the line. So the American Rescue Plan Act actually reduced premiums for Kentuckians by about 48% last year and saved Kentucky families an average of $75 per month per household. Last year, the estimate, Urban Institute estimated that ARPA saved Kentucky households almost $5 million. This year, they estimate it to be about $5.5 million. So it's huge savings at a time when any extra dollar we can have in our pockets is so important. You don't want to throw that into, you don't want to spend extra money on your healthcare premium. Like, that's not where you want to spend it, rather your food or all the other things that you need. So originally these increased subsidies would have ended this month, but thankfully, as Dustin mentioned, the Inflation Reduction Act passed back in August, extended these enhanced subsidies through 2025. And so if you've previously looked on the marketplace and thought it was unaffordable in previous years, now is the best time to go look on the marketplace. The subsidies are increased and will continue to be at a higher level, at least through 2025. So very excited about that. And that is very important, next slide, because right now is open enrollment for the marketplace coverage. Now, Medicaid and KCHIP are always open for enrollment. There is an open enrollment period for Medicaid that just ended about 11 days ago, almost 2 weeks ago. And that's an opportunity for enrollees who are already enrolled in Medicaid to change their MCOs if they'd like to. But outside of that, it is always open for enrollment. So if you or anyone you know needs coverage, you can always apply for Medicaid or KCHIP. For the marketplace, open enrollment began November 1st and ends January 15th. This is the best time to go in through the marketplace and you apply, you submit an application, and then you can shop and compare plans in your area based on your county and your basic information. It will also estimate if you're eligible for premium tax credits, which is also the piece that makes it more affordable. Again, this ends January 15th, And now is the absolute best time to go and look and shop around. If outside of open enrollment, which ends the 15th, there are special enrollment periods based on like life changes and exceptional circumstances that will allow Kentuckians to still enroll. But now is, again, it's open enrollment, so check it out. There's also an annual Medicare open enrollment period, and that ended December 7th, so almost a week ago now. But the marketplace is still open. Next slide, please. So during the pandemic, we know Medicaid played a very key part in protecting Kentucky families. Marketplace coverage played a key part in protecting Kentucky families, but we know it didn't cover everyone, and we know that we can do better. One of the options that we could move towards that would help save money for Kentucky families and help and save money for folks as they're applying for coverage would be a basic health plan. Now, a basic health plan, or a BHP, is a bridge between Medicaid and a marketplace plan. It provides more affordable options that have no deductibles, lower premiums, and cost sharing amounts. It's like a bridge, it's a hybrid between a Medicaid, the coverage of Medicaid, and a commercial insurance plan. So also upside of a BHP, it has continuous enrollment for individuals to apply at any time during the year, so you don't have to worry about open enrollment. And THFS estimated that around 70,000 Kentuckians would be eligible. Now, a couple of months we started the show, the cabinet had announced they were moving forward with the BH in January 2024, but last month, unfortunately, they announced that it's indefinitely on hold. So there's still lots of room for advocacy and to really raise our voices about how important this could be for helping families stay insured and get covered. So just pointing that out. And then for Medicare, there are some new proposed rules that include special enrollment periods for folks who miss their Medicare enrollment period, and would give them an opportunity to enroll without having to wait for the general enrollment period, which is once a year, and without being subject to a late enrollment penalty, which is actually the big deal, because if you miss your initial enrollment period on Medicare, you remain you will be permanently punished with a late enrollment penalty for your entire time that you're on Medicare, which is likely the rest of your life. So that's a new special, that would be a new rule. It is in the process of being finalized, and we expect it to be final next month. So next slide, please. And then a couple of upcoming healthcare changes that I want to make sure to cover for everyone. So the big thing that we've been talking about all year is the unwinding of the Medicaid MOE. So during the public health emergency, anyone who has enrolled in Medicaid has remained enrolled in Medicaid unless they have passed away or asked for their coverage to end. And so that means that right now, that when the public health emergency does end at some point, that Kentuckians will be asked to renew their coverage. A lot of people will be able to be passively renewed, meaning that the cabinet already has enough information on hand. They're already enrolled in SNAP. They already have access to other data sources that have enough information that allow them to just passively renew. But there are a lot of Kentuckians, we're hearing around 250,000, who will have to who will have to go through the renewal process, which means that the cabinet will send out a request for information, a notice to people. You have to respond to it and send in that additional information that they need. And then they will determine if people still remain eligible or not. This, again, it happens when the public health emergency ends. Right now, we know that that's extended through January 15th. It will be extended again, we expect, through April. So we don't really have a real firm timeline of when the unwinding of this Medicaid maintenance of effort provision will begin. But in the meantime, what we really need to make sure we're telling people is that they update their address information, your contact information, and your addresses. Because again, the cabinet will send out a notice, and if you don't get it and you don't respond, you're at risk of losing your coverage. So the basic message that everyone can take away from this is update your contact information, and just do that as soon as you can and whenever you can. If you need any help, please feel free to reach out to connectors. You can call the call center, or you can do it on Connect as well. Just wanted to make sure to say that. And then the other really quick thing that I want to say, beginning this Friday, the family glitch fix is going to be available on Connect. So in the past, the family's eligibility for premium subsidies in the form of tax credits depended on whether the employer-based insurance they were offered was affordable at the cost of the family only, no matter how much more expensive premiums would be to cover the whole family, but that's fixed now. And so beginning Friday on Connect, families can go in and apply, and the calculator correctly calculate a separate test for employee-only coverage and family coverage. So it could be affordable for the employee, but not affordable for the family, and the family can now be eligible for tax credits. So that's also a big deal, and it will open a whole lot of families. Last we heard, around 70,000 families could be impacted by that. So again, go check out Connect beginning the 16th. It's available. And if you have any problems, always reach out to a connector and they can help walk you through that process. Next slide. Other way. The final slide is moving forward. If you would like to become a resource in your community and on healthcare and how to help your community members apply for coverage, apply for connectors can also do SNAP applications, healthcare applications, Medicaid and Marketplace as well. You can train to become a connector, and you don't have to get paid to do it. You could be a volunteer for your organization. If you have any questions about that, you can complete this application that's linked below, and you can also reach out to myself and I'd be happy to answer any questions about that. So I'm going to turn this over right now to Emily, I believe. Thank you.
Thanks, Priscilla. And sorry about that slide snafu. I'm Emily Beauregard again, and I'm going to talk to y'all about the triple-demic that we are currently experiencing that I think probably nobody has been immune to. Right now, as far as COVID-19 goes, we're in a pretty low period. We had a spike during the fall that, has really ended at this point, and we are now facing a huge just increase in flu and RSV cases. And I think that we haven't seen this kind of spread and the level of infection in a lot of years. So I think a lot of that has to do with the fact that people were masking and social distancing during the pandemic. We also need to really think about making sure that people are getting back into the habit of getting their flu shots, their COVID shots, and just taking some of those precautions that we need to be taking and keeping up our guard. So this is my baby, and I just love this picture, and I think the side eye to the pandemic is how we all feel. So routine childhood immunizations, so in addition to the triple-demic that we're constantly hearing about right now, and that we're all kind of concerned about, we know that childhood immunizations have been declining. They've actually been declining for a number of years, even before the pandemic, but the pandemic accelerated this decline. And if you look at this map of Kentucky, you see that 109 counties saw at least a 10% decrease in ordering of routine childhood immunizations, and nearly half of all counties saw a decrease of more than 30%. So that means that fewer of these vaccines are being ordered, which suggests to us that fewer are going into the arms of kids who need them for daycare, for school, and just to protect themselves. And this is something that we all need to be concerned about. It's a trend that we really need to reverse. Something that I don't think enough people are aware of and really appreciate is the Vaccines for Children program. This is a really important part of our safety net that we don't necessarily think about all the time. And we don't always think about vaccines whenever, we're relatively healthy and things are going well. But having that protection means that not only are we healthier, we're able to go to work, we're able to go to school. It actually decreases poverty. It decreases disability. And so it really is something that protects all of our communities and helps us to be, stronger and more economically secure. And routine immunizations given to children born in Kentucky between 1994 and 2018, those immunizations that went into the arms of kids for a 25-year period prevented about 6 million illnesses, prevented about 13,000 deaths, and saved Kentucky $26 billion. That's about $1 billion a year. So we just need to keep reminding ourselves and others that vaccination is incredibly important, even when it's not, top of mind, the first thing that we're concerned about whenever we have other basic needs to worry about. But this is something that can help all of us stay healthier and more economically secure. And something else that not everyone probably, is hearing about these days is that COVID vaccines have saved millions and millions of lives. We knew that, the vaccine was going to be a game changer when it came out, because it meant that we could go back to some of our, daily lives, back to work, back to school. But just in the first year of having the vaccine alone, and this is when the vaccine was only available in certain countries and only available to certain populations, high-risk populations, first responders, vaccines saved 20 million lives that first year. And of course, have been saving more lives since then, and really preventing larger surges and more of those new variants that could be more, more infectious and more harmful. So it's something that we need to keep going. And, we think, well, we've already been vaccinated, or maybe we've already had an infection, we're good. Well, unfortunately, our immunity wanes. So this is new research that found that if everyone who was already planning to get their flu shot also decided to get their COVID-19 booster, then we could save even more lives, 60,000 lives in the United States, just between the fall and March of 2023. So just in that period of time, we could save 60,000 lives, and we could save millions and millions of dollars to our system. And now we have an even better booster that is actually being used as, our sort of standard COVID shot now. This has been FDA approved. So Pfizer and Moderna booster shots, originally they came out this fall, and it was for children 12 and above, children and adults 12 and above. Now they've been approved for 6 months and above. So almost every Kentuckian is now eligible for this new bivalent booster. And if you need help finding a place that is offering the booster, then you can go to vaccines.gov. It's a fantastic place to find a provider or a pharmacy in your area that is offering these shots. And you can also get your booster at the same time as your flu shot. So it's a twofer, and it makes it really convenient. And then something else that I just want to kind of remind us of as we, need to kind of stay vigilant. I know this isn't going to be top of mind for most of us right now, but like I said, immunity wanes. So if you look at COVID-19 case rates, that means the number of people who are, getting the infection, and you look at how that plays out between people who are unvaccinated, who have had their primary series, and who have had their boosters, you can see that infection risk is 3 times lower if you have your boosters, if you're up to date with all your shots. But if you look at mortality, it's even more striking. 13 times lower risk if you're up to date with all your shots. So this is something that we need to keep reminding ourselves and the people that we love and people we serve in the communities that we all work in, to make sure that they are up to date. It's not something everybody wants to talk about these days, but whenever you are a trusted messenger and people listen to you, and people know that you've had a good experience getting your shot, they're more likely to. So just keep that in mind. And then if you ever want good information about vaccination rates here in Kentucky, this map is one where you can scroll over and see information for your county. You can see who's had at least one dose, who's been fully vaccinated, who's been boosted. And that's all broken down by different populations and demographics, which is really fantastic. And the thing that really gives me hope about this map is if you look at people ages 65 and older, their vaccination rates are through the roof. And truly, this is herd immunity. So if they can do it, we can do it. It's just a matter of getting more people to take a minute and to think about this differently. And there was a poll that was conducted by the Foundation for Healthy Kentucky. I think it was back in July, and these results came out in August. So pretty recent. Kentuckians were asked about, whether they had gotten a COVID shot and also whether they would be willing to if they hadn't yet. So we know that about 3 million Kentuckians have had at least one shot. That leaves about 1.5 million who have not yet been vaccinated. But with this poll, we found that 1 in 3 unvaccinated Kentuckians are still open to getting their shot. And they had different reasons for that. Some people needed it to be more convenient. Some people were waiting, actually the majority were waiting to, find out what other people's experience was with the shot. They just wanted to know how it was working for other people before they went and did it themselves. And then some people would be more likely to get it if their school or if their employer required it of them. And so we have about 500,000 people who are still open and we can have these conversations with. And if you need any good materials as you are talking to folks in your community, talking to your family, this is our kind of one-stop shop for immunization outreach. This is a website that was created in cooperation between the Kentucky Department for Public Health and all of the organizations that you see at the bottom of the screen here. So it was really a public-private partnership in which we all came together to figure out what information Kentuckians need and how we should be sort of putting that information together in, fact sheets, graphics, social media, so that people get the information and are, able to understand and use it. So you can go here for all of that. They have some great, social media and graphics that are really easy to just kind of plug in, and you don't have to do a whole lot yourself. And so I'm now going to turn it over to Priscilla to talk a little bit about KY Loop.
Thank you, Emily. Back and forth, I love it. So as we did our in-person roadshows, and I've talked to Friskies and CHWs and connectors and all of the folks across the state, one of the common things that we've heard is just how much time people spend trying to find resources and information, how much time people spend trying to get simple questions or seemingly simple questions answered, or just trying to find the right information to help their clients in the best way that they know how. And so next slide, please. If you just think about what are some of the things that you have problems finding in your day-to-day life, as you're helping consumers, as you're working with folks, what are some of the questions and resources that always come up for you? How much time do you spend trying to find those answers? For me as a connector, I know that I spend an inordinate amount of time talking to DCBS or just on hold waiting to get to DCBS. And I know that there are so many other things I could be doing in that time that I'm on hold with DCBS. And so one of the things that we decided to do was to build a website. It's called KY Loop. Next slide. And so KY Loop, it has a lot of different functions. Our main functions right now, we have a resource repository, a directory of lots of different resources for food and health, public health, housing, I always forget one, childcare assistance. That's always the one I forget. We have all of these resources frequently asked that people have suggested to us, people as they have used them more often, things that they have bookmarked for themselves. People have shared those with us and we add those to our resource repository. So if there are other resources that you want added, we're constantly adding to them. and making sure that this list grows as our community grows as well. The other really cool part of KY Loop, which isn't quite functional, we have our resources, we have our news and events up and ready to go. But apparently we ran into some issues making sure that the forum actually functions correctly. Apparently a bunch of advocates don't know how to develop that by ourselves. And so we've had to take a little bit of time to work through some of the technical issues. But coming soon, we will also have a forum where people can ask questions, share stories, share information, share best practices for helping clients, other ideas that you're doing in your area that you want other people to know. And it's really about just feeling more connected to other professionals across the state who are doing similar work and sort of sharing the load of finding and sharing resources so that no one feels isolated and like it's only on them to solve all of the problems. So we're really excited about it as we've talked about it and plugged it in real life to people through our roadshows. There's been nothing but excitement, and we're just continuing to grow and build out the resources and news and events like that. So please join us at kyloop.org. If there are resources that you know that you use, feel free to send those to me and I will add them to the website so that other people can benefit from that. And so that together and collectively, we have a really rich list of resources that everyone can access and use. So really excited to get that started. And once the forum is live, then we can have real conversations with each other and sort of share that space and share best practices and ask questions. So really excited about that. Next slide. And we'll also, next slide. And then the last thing that I want to plug, there's also a report a problem button on KY Loop. And it links to our comment on Connect survey. We know that since Connect has come back, there have been some technical issues and problems that people have had to work through. And so we wanted to be able to collect this information for folks and launch a public reporting tool. Agents and connectors, we have our own issue tracker that we can report issues through, but we realize that the public and other folks who help people do application assistance and help people apply for benefits on Connect don't have that same access to that issue tracker. So we've developed our own, and this is linked on the KY Loop survey. It is linked on KY Loop under report a problem. It's also in the slide, it is live. So if you have any problems, if you know of anyone who's having any problems, feel free to report any issues on the survey. We're also tracking this information and we'll follow up if there are technical things that we can help report to the cabinet and troubleshoot for folks. So that's also a really great resource that we wanted to make sure to plug. And I believe that is it. So I will turn this over to Dr. Schuster, which is my favorite part of our webinar.
Thank you very much, Priscilla. And somebody put in the chat that they love your background. It feels very holiday, so lifts my spirits. Thank you. And it's exciting that KY Loop is going to be out there. So good, I guess it's still morning. Good morning. Next slide, please. I'm going to start with a basic that we all know, but I think it really helps to be reminded about it. And that is that a democracy requires that the voice of the people be heard. We cannot have a democracy. We cannot have the rule of law. We cannot have our policymakers be held accountable, all of those things, unless we, the people, speak up. So this is one of my favorite pictures. This is one of the coalitions that I helped lead. This is the 874K Disabilities Coalition. Represents over 874,000 Kentuckians who have a disability. That might be sensory, might be a mobility issue, maybe a developmental or intellectual disability, an acquired brain injury, a mental illness, or a substance use disorder. They make up 23% of our population here in Kentucky, and that's probably an underestimate because the census data did not report children under the age of 5 or those who were already in institutions. So think about the power that these folks would have if we could get them all registered to vote and raising their voices. So for 22 years, we've brought hundreds of folks to Frankfurt for our 874K Day. And we make our voice heard by gumming up the works in Frankfurt in a way. We make it hard for people to get into the cafeteria or into the meeting rooms. And why do we do that? Because I want legislators to think about people when they vote on the budget. I don't want them to think just about numbers. I want them to remember their constituent who had to navigate a non-ADA compliant annex and rotunda to come and have their voices be heard. So I just think it's really important for us to remember that if we don't speak up, we cannot have a democracy. Next, please. So just a reminder that all of those legislators are elected by you, and therefore they're elected to serve you. The governor is elected by you. And so all of the executive branch, and we've heard that throughout this presentation, the Department for Medicaid Services, the Department of Transportation, the Cabinet for Health and Family Services, the Department for Education, for Behavioral and Public Health, all of those are executive branch. And while you don't elect those commissioners and so forth, you elect the governor, who is their boss. So again, a democracy requires that the voice of the people be heard, and they cannot serve you unless they hear from you. We can attribute all kinds of things to policymakers, but they are not mind readers. And if we don't speak up, then we really cannot hold them accountable to respond to us and our issues. Next, please. So we need to understand that our issues are about policy and not politics. So think about this for a minute. We live in such a polarized and politicized world these days, and it's very hard to think about any of these things as not being political. But there's not a single thing that you've heard today that is political. Housing is not political. Childcare is not political. The economy is not political. Healthcare and mental health care are not political. The process can be political, and the policymakers very often make it political, but don't back away in talking with any policymaker about your issue, because your issue is not political. Your issue is about the people. I know that you care, and you care passionately, and you want to be knowledgeable about your issues. That's why you've joined us this morning, and we appreciate it so much. One of the things that I hear all the time when I talk with groups about reaching out to their legislators is that they're concerned. And what are they concerned about? They're concerned that a legislator or somebody over in the executive branch will ask them a question that they don't know the answer to. And there's what we call a demand characteristic. When you get asked a question by someone that you think has some power, your immediate response, your psychological response is to say to yourself, surely I must know the answer. He's expecting, she's expecting that I know the answer. So I'll just make up an answer. And some of you are probably very good at pulling out things out of what I call out of your left ear. You may have gotten through school that way. Please do not do that. You want to be a resource to these policymakers. So you want to be sure that the information that you provide is accurate information. I've been going to Frankfurt literally for 44 years. And there's never a session that I don't get asked a question that I don't know the answer to. Sometimes I think they just throw me ringers because they know me well, and they're just trying to see if I have an answer to it. So think about it as a golden opportunity. You're in a meeting with Senator Smith. Well, we have a Senator Smith, Senator Jones, and you're having a good discussion about your issues. And Senator Jones asks you a question like, what are the implications for the budget? And again, your tendency is to make up something. So you say to Senator Jones, that is a great question, and I don't have that information with me, but I will get that information for you. Tell me the best way to get back in touch with you to get you this, the answer to your question. And in most cases, that legislator who you've spent some time with at this point is going to give you maybe a different email address than the LRC email address that gets bollocksed up very easily. They may even give you their cell phone number. They may tell you to message them on Facebook. They may give you contact information for a staff person or somebody they're working with. And then, for gosh sakes, do your homework and get back to that legislator with that information. That kind of closes the loop and establishes you as somebody who's accurate and reliable as a resource. If there is not an answer, or there's not an answer that you can find, Still get back with that legislator. Maybe you found some information about budget impact in other states, even though you don't have it for Kentucky. Or maybe you can provide some other information that you talked about. But again, you want to close that loop so that you have a working relationship with that policymaker. We have access to the free media. I've never worked for any organization that had enough money to buy media, but we have the voice of the people, and the media is very, very, very interested in doing what I call putting a face on the problem. So if you think about the way that stories are presented in the paper or on television or on the radio, it's not the policy that gets talked about so much. It's giving an example, and that example is typically a person, a family, a community that's being affected by the problem. We can rally grassroots support, which is so important, so that your local community is all talking with the same message to those legislators. You can work in in coalitions with others so that your voice is magnified, and you have to be willing to speak up. Next, please. So this is my guilt slide. Get ready for that. This is a picture of one of our 874K gatherings. We had about 1,000 people there when there was still a convention center in Frankfurt, and we would have legislators come. We would have every 4 years, we would have a forum for the gubernatorial candidates. So my questions are these: who understands the issues better than you do? And it doesn't mean that you have all the answers, but it means that you have a really good idea of what the issues and the problems are. Whose voice will be heard if it's not you? Let's not assume that Joe over here or Susie over here is going to be the one to step forward. You've got to be willing to step forward and make sure that those issues get communicated. Again, policymakers can't serve you unless they hear from you, and we can't hold them accountable unless we have asked something of them, and then we go back to check to see whether they've made any effort to work on a bill, to communicate with the executive branch, to work on a regulation. In other words, have they been responsive to you and the people you represent, the voices that you're carrying to Frankfurt, and ask for their action. Next, please. Excuse me, this is my post-COVID cough. So we have two ways to participate in our democracy. It's your voice and your vote. And of course, we were doing these road shows all during the summer and fall before the election on November 8th. But guess what? We've got elections coming up next year. So again, your vote is another important way for you to participate in the democracy. But don't just think about your voice and your vote. Think about others you can influence to vote and to speak out. Think of the young people in your family or in your network that are turning 18 and can register. You can even register before they turn 18 if they're going to be 18 at the time of the election. Are there people who think they were registered and didn't check and then went to the polls and found out they weren't? You know, let's reach out to so many of the justice involved individuals who, because of Governor Beshear's executive order, have their voting rights restored, but need to go through the process of getting registered. Next, please. So what do we know about what happened in 2022? Technically all 100 House seats were up. The Republicans had been in charge, having 75 of those 100, Democrats 25. There was a pickup for the Republicans of 5 seats. So we now have in the House 80 Republicans and 20 Democrats. In the Senate, where it had been 30-8, it's now 31-7. I will point out that there was not a single Republican incumbent. In other words, there was not a sitting legislator who was a Republican who ran for office who was defeated. So all of those losses came from either open seats or contests where a Republican challenged a Democrat, and the Republican won that election. The congressional delegation, in other words, our 2 senators and our 6 congresspeople, remain unchanged except in the 3rd congressional district, which is Jefferson County. That district, which is where I live, and has been represented by the Democrat John Yarmouth for, I think, a dozen years or so. He's retiring, and current Kentucky Senator Morgan McGarvey will succeed him, also a Democrat. There were many judicial races, even Supreme Court seats, all the way down to some of your local courts. And some of your local races were determined. We elected a new mayor, for instance, in Louisville, and I think a lot of you had school board, Metro Council, mayoral races. Both of the constitutional amendments were defeated. One would have given the legislators the power to change the calendar of the session, actually, to extend it. And I personally was opposed to that because very often they don't get a lot of work done until those last few days before the end of the session. If they had had the ability to push that out another 10 or 15 days, we would have been, again, not getting a lot done until the last couple of days. The other was an abortion amendment, and it would have changed the Kentucky Constitution to make very, very clear that abortion was not possible in Kentucky. And that was also defeated. I think one of the most disturbing things for me in terms of the election was the poor turnout, 41.8%. So 1.5 million of the state's 3.6 million registered voters actually voted in the November election. That's the lowest in Kentucky since 1994. And I am super disappointed in that. I really thought that with all the emphasis on these midterm elections and their importance, with the 2 constitutional amendments on the ballot, with the number of contested races and so forth, the local races, that people would have turned out. We've got to do better than that, folks, if we're going to have a democracy. Next, please. So again, 2023 is an important election year. There will be special elections probably in February. There are 2 Senate seats in Kentucky that are being vacated. One, as I mentioned, by Senator Morgan McGarvey, who will be sworn in as our congressional representative from Jefferson County. And the other you probably saw on the news is Senator Ralph Alvarado. Senator Alvarado is a physician who's been chair of the Senate Health and Welfare Committee and serves on many committees having to do with healthcare, Medicaid, and so forth. He's been a very, very active member of the General Assembly. And he is leaving in mid-January to take a position in Tennessee as their Commissioner of Health. So those will be 2 different special elections. Only people that live in those senatorial districts will be able to vote. The nominees will come from the 2 political parties. So there's no primary, but the Democrats will nominate a candidate in both of those districts, and the Republicans will nominate a candidate in both, and then we will have an election. So the real focus will be obviously on the statewide offices, particularly on the governor. So we know that Governor Beshear wants to be reelected. I think there are 2 Democrats who will challenge him in the primary. I've kind of lost track of the number of Republicans. I think we're up to an even dozen who are all vying, will be vying in the May primary to be on the ballot in November for governor. The other statewide offices are, excuse me, Attorney General, Secretary of State, Auditor, Treasurer, and Agriculture Commissioner. So the primary is May 11th, registration roughly a month before that. The general election will be November 7th with registration by October 10th. Again, be sure you're registered, spread the word to increase turnout, and be sure to vote. We've learned this over and over again that elections do have consequences. Next, please. And again, vote like your life depends on it, because so many aspects of your life do depend on who gets into these offices. Next, please. So this is my kind of therapy slide. If I was practicing as a child psychologist and I was seeing you in therapy and you kept coming in, kind of talking about the same problem over and over and over again, at some point, I'm probably going to say, you know, you need to decide whether you're just going to live with being a victim of this problem or whether you're going to do something about it. So I always say to people, Frankfurt's going to happen. They're going to do their thing. They're going to get into session. They're going to pass all kinds of bills and defeat other bills. So you can decide whether you're going to be a part of that or not. And while victim implies that everything they do is bad, and I'm not implying that, but you will be the recipient of, and it will impact you in terms of what they do or don't do in Frankfurt. So I hope you'll choose to be an influencer of that system. Next, please. So let's talk a little bit about the 2023 session, because it will be upon us momentarily. It will start on January 3rd. They start on the first Tuesday after the first Monday in January. This is our short session. So they actually have two parts, which is interesting. They'll go in on Tuesday the 3rd. They'll stay up there till through Friday, possibly through Saturday if they have bills they want to pass. All the legislators will be sworn in. They'll be given their committee assignments. They'll begin to introduce a slew of bills. Newly elected leadership for the Dems and the Republicans in the House and Senate will take their positions. After that first week, they will recess until February 7th, when they begin part 2, which will end on March 30th. So here's my big tip to you. That time period between January 7th and February 6th next year is a great time to talk with your legislator at home. You know what committees they're going to be on. They look maybe a little bit less like deer caught in the headlights, even the new ones, but it's a great time to reach out to them and have some of the other people in the district reach out to them. And always remember that you can follow the action through Kentucky Educational Television, and you can access all kinds of information at what we call the Legislative Research Commission website. Also, they now have developed a YouTube thread, and they will show committee meetings on that. So here's the tip. When I started going to Frankfurt in 1978, the only way you could get a bill was to have them fax it to you at 25 cents a page, or you could drive to Frankfurt and go to the bill room and pick it up for 10 cents a page. Well, you can get everything on this website, and you can watch all the action either live or archived. So you can be at home in your pajamas if you want, with your favorite beverage in your room, and follow all the action. You can email people, you can call from home. I do think it's helpful and important to come to Frankfurt if you can and meet in person, but if you can't, you can really be involved in the action. Next, please. So there will be 31 new legislators sworn in on January 3rd, 25 in the House. So that's 25% of the House will be brand new. 6 are new to the Senate. So whatever your passion is, whether in my case it's behavioral health, or whether in your case it's food security, or it's housing, or it's the economy, whatever it is, think about the fact that all these new faces are coming, and they probably don't know anything about your topic. They may not even know the terminology. They may not be aware of even the most basic problems. They may not be aware of the history of what your organization has worked on in the past. So your work is cut out for you to get in touch with those new legislators, to introduce yourself and your organization, and to begin to educate them about your area of passion. There's also a number of new committee chairs in both the House and the Senate. There's a new committee in both chambers on family services. They split that away from health. So there's now a health committee or a health services committee, and then there's a family services or a family and children's committee. So kind of the welfare part of it and the health part of it. We know that the annex will be open, but we're not sure that large gatherings are going to be possible because of the shortage of meeting rooms. Emily and I will put together and update our kind of summary of the posting rules and other operational rules, including accessibility, and we'll be posting that through KVH. So stay tuned on that. Next, please. So check out the website. Everything is up there. And again, you can watch on the KT or the legislature's live stream. Let me remind you of the importance of the legislative message line. 1-800-372-7181. Takes about 2 minutes maybe to register the very first time, name and address and phone number. And then after that, it probably doesn't take more than 30 seconds to call the switchboard. And they may even be open later than 6 p.m. during the heat of the session. I always say, I don't know what kind of medication they give those switchboard operators, but they are uniformly the most pleasant and helpful people I've ever talked with. And I've talked with them a number of times at various times of the day. Basically, they're going to say, what's your name? They're going to pull up your file, if you will. They're going to say, what's the bill number? Who do you want the message to go to? And what do you want the message to be? So when I send out action alerts, and KVH does the same thing, I try to put those in the email that I'm sending out. Here's our bill number, really helpful. If you just say, it's the mental health bill, there may be 20 or 25 mental health bills. Now they will help you try to figure out which one it is, but really helpful if you know it's House Bill 123 or it's Senate Bill 678. Who do you want it to go to? It could go to a single legislator, or it could go to an entire committee. And then also remember that you can reach legislators' offices at 502-564-8100. And they have receptionists and they can help you out. And you can email legislators. Next, please. I just realized we're running out of time. So there's material in your packet about how you can tell whether you are advocating or lobbying. I know some of you have some restrictions through your organization. But basically, if you are educating about an issue and stop short of saying, vote for this, you are advocating, you are not lobbying. Next, please. And again, here's this is an excellent piece to help you differentiate between advocacy and lobbying. Next, please. So engage your community. The more voices you have saying the same thing, the better off you are. When we passed a really important bill around insurance coverage, we had the faith community involved, and they were very powerful in reaching legislators. And the legislators, a couple of them said to me, why am I hearing from my minister? And I said, because this is a discrimination issue against people with mental illness and substance use disorder. But they were very powerful. So think outside the box, think about who else you can get on board and engaging your community. Next, please. Remember, all politics are local. I know people out in the more rural areas or further away from Frankfurt feel like they don't have a voice. Actually, rural legislators dominate leadership in both chambers. There are rural caucuses of legislators, and believe me, your legislator in your rural area is very powerful in Frankfurt. Next. So remember, the most powerful statement you can make is, I'm your constituent, meaning I live in your district and I vote. And that makes you powerful because you can vote to keep them in office or to shoo them out of office or to send them to a different office. You also can say to a legislator, I don't live in your district, but I provide services to your constituents. In other words, I work at this clinic, or I'm a hospital worker and we serve your constituents. And remember, this is not a John Calipari one and done. This is really a process of staying in touch with your policymakers. Next, please. So we have Holly Hudnall is actually on. This is Christina Libby. The more animated you can make your message, the better off. So we have some tips and some help for actually making short videos. One of the ideas that we have is, if you have a powerful constituent who can't get to Frankfurt with you, have them record a message on your cell phone and show that to the legislator. Here's somebody who's living with this issue. Here's what needs to get fixed. Next, please. So remember, it's not always logical and rational. That's really hard for me as a psychologist, but it's well worth doing. And those who love sausage and the law should watch Neither Being Made. Although we do make good law, sometimes the process is kind of ugly. And next. So again, remember that our issues are not partisan or politics, but the process is. The Republicans hold the super majorities in both chambers. So they're going to have all the committee chairs are going to be Republicans and the majority of members on committees. But your Democratic House member or senator still has a vote and a voice, and they can be very influential in the debate and in the votes. Next. So again, how will your voice be heard? Contact them. You can contact your legislator and put in the subject line, I am your constituent. Do not do that to 138 legislators, only do it to your House member and your representative, and put your home address in so that they know that. And remember that message line. Next, please. And finally, never forget that a small group of thoughtful people could change the world. I think you all are that thoughtful group. But remember, you can't change the world unless you're willing to be engaged and to speak up. And I'm available as a resource. My email is in the materials that you received. And I will turn it over to Emily.
Thank you, Sheila. And thank you everyone for staying on with us. We did pretty well on time this time. We packed so much into these trainings that we understand that it feels like kind of a fire hose, but you'll be getting all of this information in a follow-up email, the slides, the recording, resources. And of course, you can reach out to us if you need anything. And I mentioned we'll be doing this again next year. We're going to make it a little longer so we have a little more time to cover everything and answer folks' questions. So watch for that information. And if you are free tomorrow, if you'd like to learn more about Medicaid renewals, that unwinding that Priscilla talked about, the benefits cliff that many low wage workers face, and the 2023 General Assembly, what the agenda is, what health bills may be being filed soon, and where we can advocate. You are welcome to join us at our annual meeting in Lexington tomorrow. I put the registration link here. And if not then, I'm sure that we'll see you sometime soon. We'll have our next policy update, our state and federal policy update in January. And we'll be putting that date and registration link in the follow-up email for y'all as well. So thanks again, everybody, and have a good day.